Today, I would like to talk about the major global health issues and where Turkey stands with respect to those problems. I will then wrap up with what I think we most need to improve public and global health. Well, global health, as defined by Macfarlane, is the improvement of health, reduction of disparities, and protection against global threats that disregard national borders. What does that definition tell us? Well, just think about infectious disease epidemics, such as swine flu or bird flu, and its relation with the high mobility in the world. Or think about tobacco use and its relation with the global tobacco industry. Or think about human trafficking related with sexual exploitation of women or organ transplantations. Or think about drug trafficking with increased drug use and HIV/AIDS in the world. Today, we know that these problems have no boundaries. And it is not possible for countries to isolate themselves. Although there are disparities between countries with respect to the burden of diseases and life expectancy and the quality of life, we know that today most of the problems affect all of us. And that's why many countries face similar problems with changing severity. Well, today we also know that health has so many determinants, like social factors, cultural factors, economic factors, and environmental factors. And all of these factors are closely interconnected. Well, I just would like to give you one example: global warming. Today, we know that global warming leads to, and it will lead to, natural disasters, such as floods and water shortages. And in the future, it is also projected to lead to increased migration and increased armed conflicts, which will affect the health of many populations around the world. So in tackling global problems, it's very important that we see the connections and we see the big picture. Well, my personal story has also something to do with seeing the big picture. Starting with my childhood, I was always very interested in health professions. I guess I was very impressed by my parents, who are also health professionals, and what they were doing to help people. Years later, when I was a medical student, I was so passionate to become a clinician and to work in clinics and to treat patients. But when I was in 4th grade, something has started to change. I started to work in a students' association and started to volunteer for some small projects. And my journey as a volunteer in small projects continued with non-governmental organizations and then international organizations such as United Nations. And then I had the chance to travel other countries for international projects. And I think why I preferred to be in the field rather than in the hospital is that my volunteer work and my travel around the world has made me realize that people were not getting ill or dying because of infectious diseases or other biological reasons. They were getting ill or they were dying because of the underlying reasons, such as hunger and poverty, or gender differences and inequalities, or just because someone was born as a minority. That's why I think I prefer to work at the community level rather than the individual level. Today, the global health has so many topics, and here I just would like to mention a few. Among them is international migration, with more than 200 million migrants around the world. And today we know that migrants, especially during forced migration, face challenges such as physical and sexual abuse, and challenges with access to housing and nutrition and access to health care. And they have challenges such as cultural barriers, or social barriers, or legislative barriers. Global economic crisis is another very important topic, because we know that economic situation, income, and job insecurity are very important determinants of health. And we also know that economic crisis leads to increased unemployment, and it causes increase in drug prices and difficulties in attaining drugs, and also financial difficulties in public and private healthcare sectors, which all cause inequalities in healthcare. And other topics such as urbanization, food crisis, energy crisis, which are all related to population growth. They are all very important topics in the global health agenda. And besides the growth of population, aging of populations is also very important because it leads to an increase in chronic diseases such as cardiovascular diseases or dementias or degenerative diseases. Well, just think of Alzheimer's disease, which was not a problem back in the 1920s or 30s when people were not getting old enough to have Alzheimer's disease. Or think about cancer. Today, our lifestyles and environment have changed so much that we now have a global cancer epidemic. That's why today we need to establish cancer screening centers, and we need to build large oncology hospitals, and we need to invest a lot of money in treatment of cancer patients. As I said before, everything is interconnected. That's why mutual problems and problems with no boundaries need to be solved with international collaboration. We have to work together to fight against epidemics, and we have to work together to fight against cross-border trafficking or the causes of chronic diseases such as tobacco use and unhealthy food. Because a patchwork of isolated efforts will not be enough. One common argument is that our resources are very limited. We say that our resources are very limited even in high-income countries, which is true. But when will we say that we have enough resources? Never. Our bigger problem is the unequal distribution and inefficient use of resources. Well, I will get back to this later, but let's move on to Turkey now. Just as Turkey is a mosaic of food and cultures and music, it's a mosaic of health problems. Because we face problems of both low and high-income countries. That's why we have a double burden of disease. In the last 90 years, we have accomplished a lot in infectious diseases. But on the other hand, we have still children dying from very preventable causes, such as lung infections and diarrhea, which are mostly the problems of low-income countries. But on the other hand, we have some good news, and that is our life expectancy has increased. It increased up to 72 years, which is really good. On the other hand, it's still 10 years less than in high-income countries. We now live more, but we also face more chronic diseases. And aging is not the only factor here, because our lives has also changed. We have changed our lifestyle. We eat more, but we move less, and it leads to increased obesity in Turkey. And smoking, of course, is still a very huge public health problem. But at this point, I also have to mention that we have accomplished a lot in tobacco control in Turkey, and we have one of the most successful programs in the world. What about other topics such as migration and drug trafficking and human trafficking? Well, we face all of these problems because we stand right in the middle of very important migration and trafficking routes in the world. And Turkish migrants abroad face challenges such as access to health care, and they have higher diseases than the populations they live in. Turkey is also a transit country with respect to many refugees and asylum seekers, and these populations also have difficulties in access to health care in our country. According to the Human Development Report in 2011, Turkey ranks 92nd out of 187 countries. And we still have problems, and we still have a gender gap. We need to take more steps in achieving universal healthcare coverage. And also, out-of-pocket money we pay for healthcare is very high. And effects of global economic crisis and high unemployment also have effects on our public health, which increases the gap between the rich and the poor. Well, also, Turkey invests a lot in treatment services. We spend a lot of money in building large hospitals and buying expensive medical technology. But on the other hand, preventive services constitute only 5% of our national health expenditure. But we know that prevention is much cheaper than treatment, and it's the most cost-effective strategy. That's why, besides treating patients, we also need to spend money on prevention, and we need to design health education programs and school health programs, occupational health programs. And we need to promote healthy behaviors and healthy environments. We also have to see health as an integral part for all of our national policies. Like, health has to be an integral part for our social policies and education policies, or transportation or agricultural policies. I think that is what is needed in most countries. Well, the key point we should remember is that health is a human right. That's why it is not something that we can sell or buy. We should not forget this, and we should never let others to forget it, because that is what makes governments responsible for health. Governments have a major responsibility, but what about us, the individuals? We also have, and we do share some of the responsibility for our own health, for others' health, and for environmental health. I believe there are two key words here: feel responsible and share. Do we have all the answers and resources to tackle global problems? No, we don't. But we have a huge amount of scientific evidence, and we have policies and interventions that we know that work. On the other hand, we'll never know all the answers, and we will never have enough resources. I think two things will help us to move beyond our knowledge and resources. The first one is that we need to feel more social responsibility, and the second one is that we need to share more than we do today. It's not easy, but I also think that it's not impossible. That's why I think what we need to teach our children more than anything else is to be sharing and responsible citizens, and teach them that every single contribution is valuable. We need to make every effort for the next generations to see things from different perspectives and to see the connections and the big picture. And we need to raise them in such a way that they feel, act, and share, not only as the citizens of the country they live in, but also as the citizens of the world. Thank you.